Good morning and welcome to the special edition episode 98 of the On-Air Advocate. Where on the On-Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On-Air Advocate. And I am super excited if you are here this morning joining us, or whether you are catching this on the replay. Now, as always, please remember that if you think any of this content that we are talking about today could be beneficial for anyone within your network or your circle, please share the love and hit the share button. Now, today I am very excited. Like I said, we have a special edition today, and especially when we look at that it is December, the wrap up of the year, the holidays, and we think about us just as individuals, how much chaos is going on inside of us, behaviorally for us as adults, for kids, and then we take that to the next level and look at our community of those with different abilities and some of those behavioral challenges. And so I am so excited to have Sarah Hardison here. She is a licensed behavior analyst, and she is going to share with us 6 different behavioral strategies that parents and teachers can use. And this is not just in the holiday season. This is all year long in the classrooms at home. And so Sarah, I am so excited to have you here today.
Thank you, Tam. I'm really excited to be here. Thank you so much. I think what you're doing is absolutely awesome for all the families out there.
Thank you so much. And, I think what you are doing, as we've talked about, chatted about on the phone, is that there is such a lack of providers out there and the need is so great. And so I just want, before we kind of dive into those 6 different strategies, could you give us a little bit about your background, what you do, like what does a behavioral analyst do, and kind of the population that you serve and why there's such a need?
Sure. Well, behavior analysts have a wide variety of responsibilities in the community, and really the principles of behavior analysis apply to everyone, not just individuals with different abilities, but they can be applied in management and supervisory roles, the business side of things, adults, children, your spouse, your significant other, your siblings. These principles apply to everyone. So behavior analysts do have a wide variety of roles in the community, and really the field is growing tremendously. Not just with individuals with autism, which is typically what behavior analysts are known for, but just all around. The science is fairly young. But it's well researched and evidence-based, and so there's a lot of different roles that we can play. My primary role as a behavior analyst is a consultant to families, individuals with different disabilities. I work in school systems and residential settings. I do some supervision of individuals pursuing board certification, and typically just work with the caregivers and the natural supports of individuals to teach them skills that are going to make improve their quality of life, make them productive members of society, and just overall improve quality of life at home and in the community. So there's a wide range of
now, so you work with actually the young adults or children themselves, but you also partner and work individually with like staffing, teachers, parents, that sort of thing,
Absolutely.
Right? If they need aid and help, and them developing those strategies also for them, selves to be able to use the tool.
That's the key. That's the key for sustaining change and improvement, because the typical model, if you look at a typical clinical model where somebody might go to a clinic and sit for an hour and talk about their feelings and not that that's not beneficial, because that can be for certain populations and certain issues. But the individuals that we work with, when we're talking about problem behaviors that interfere with community and relationships, you really want to go where the problem behavior is occurring. You want to go where the struggle is, so you can integrate within that system and really promote some behavior change within those environments. So I always tell families I work with and professionals that this is far less about me changing the child or the individual. This is much more about me changing the interaction and the dynamic between the caregivers and the individual's environment. Because from a behavior analytic perspective, behavior, good and bad, behavior is behavior. It's what we do. It doesn't always have to be bad. A lot of times that's typically what people think of as the bad stuff. But everything that we do is maintained by contingencies in our environment. So it's shaped, it's reinforced. We do things because they work for us. So in order to change things, we have to change the interaction with the environment. So that's really where my key focus is. There is the intensive model of ABA, applied behavior analysis, that is typically referenced and most people are most familiar with. And that's the intensive model where you might have a team of therapists that come in, and you have multiple line therapists that come into your home and work for 35 to 40 hours a week. Very evidence-based model of treatment. That's not my model. It's not for all ages. Typically, typically kids are starting school or adults are in the community and working, and
right.
they can't always have that intensive model, and it's not always appropriate for all individuals at some point in life.
Now, for that intensive model, so there's different individuals that are coming in, so it's like a whole team that's made up.
For the intensive ABA treatment, so early intervention, typical intensive early intervention, which was the first studies on ABA in the implementation, was that intensive model of the 35 hours a week, and the tremendous improvement for the children that received that treatment. And the children's ages were typically between 2 and 5. So it's really pre-academic. So it's to kind of ideally it's to get them ready for school. And then we hope that the school can take over and provide that intensive or that level of treatment that's necessary at that point. So it's kind of like a it's not always that's not the only way to do it, but just historically, that's the way it's been implemented. So that is still being done. And there's a lot of great providers in the area and across the country, across the world, around the world that provide that intensive treatment for children with behavioral needs and skill deficits. Unfortunately, like you had said at the introduction, there's not a lot of availability. There's a need for providers. A lot of families are on waiting lists for treatment. So
the need is so great, just like kind of like when we look at our caregiver crisis and all of that thing, the need is so great, but there's just not enough individuals and enough time for those individuals to provide that. Because, even at the light level, it seems as if in us chatting, you are pretty involved with family, schools. It's not just something like you're there for, an hour one day and then you don't see them again.
No. Yeah, it's yes. Typically, my model right now is I provide focused treatment. So typically individuals that are very high needs, so they have significant behavioral challenges that really interfere with their functioning. A lot of times my referrals will be just one step before residential is being considered for families, because they just get to the point where it's not safe anymore in their home, and they're really feeling like there's not much more they can do. So I deal with some pretty significant behavioral issues. Not always, but a lot of times, unfortunately, that's the referrals that I get. But it really requires me to coordinate across environments and reach out to families, support network, schools, respite providers, daycare providers. I mean, whatever.
Every person who's working with that individual to try to get things as harmonious as possible.
Yep. Consistency is
okay.
Yeah. And that's often the challenge, right? I mean, that's very difficult to do. It sounds easier than it is, unfortunately, because we're talking about behavioral issues for an individual, but we all have our own behavioral issues, right? We all interact and do certain things a certain way. So really we have to change a lot of different behaviors to impact that one presenting client.
Right. And is there a great challenge you find across the board? I know in our area here, I know when I'm speaking with different residential living facilities, helpful places that take individuals that have behavioral issues, it's very, very limited. So the scope of places that you have to choose from becomes extremely limited when we talk about going to communities or residential living for those with behavioral needs. Would you say that you found that kind of across the board everywhere, with other providers that you've spoken with?
Absolutely. Yes, absolutely. It's a major, and not just in this state. I mean, I think that's across the country. Some areas are better. I think that there's a great need. One thing that I've noticed, I've been talking to colleagues too over the years, that, you have a lot of great supports for the kids that have that, and there's still a waiting list for those supports, but for the kids that are younger, right, and they have a lot of skill deficits, and there's sort of a comprehensive, intense program. And then you have individuals that maybe are extremely volatile and extremely dangerous. You might have more options for them compared to this, like there's this middle group that gets kind of lost. So maybe they're not severe enough to go residential. They should ideally live on their own and somehow be able to transition into a more independent living environment, but there's not an environment that can support the needs that they do have. So there's no middle ground. There's really, and that's across the board, I feel, that there's just not a lot of options. And I always encourage parents to, I will bring up, where do you see your son and daughter, when they do turn 18 and when they do become adults, and to really start thinking about that a lot sooner than you think you need to, because it comes quickly and there aren't a lot of options, and you want to do your research and your homework sooner rather than later so that parents have the opportunity to make that choice, a well-informed choice, and not be pushed into a position where there is no choice and they have to just take the first available. So really to start talking about those things during those adolescent years and say, where do we see our child going?
Yeah. And, myself, and I think we spoke about this, my son is 21 now, and I thought, I being a very, very strong advocate for him in the younger years, and knowing the whole map. And then I was like, oh, what is this? And I really think that it should start around between 14 to 16 years old. I think parents should really start navigating at that age, because it does take that long to find, resources, and you may not find what you think you're looking for or you need. And then you might have to restructure your life as, your work, what you do in the workforce, and your hours of the day that you'll be able to work and things like that, which may structurally take much longer.
Absolutely. And that age range, that's exactly the age range that I shoot for. The 14 to 16, definitely by 16. Yeah.
Yeah. To start looking at that. So now I know. So now I'll that age on. Now I've learned for myself about that. So now I would love to start to kind of dive into some of those behavioral strategies. And I know you gave me an awesome list, so I can't wait for you to share.
Okay. Well, first, the disclaimer, right? So as a behavior analyst, I really feel it's important. One thing that I feel in disseminating information is to educate consumers, so parents, caregivers, any schools, anyone out there. There is no template recipe approach to problem behavior. You have behavioral struggles, behavioral challenges with individuals. If you run across a provider that says, oh, they engage in physical aggression, do this, find another provider, because there is no catch-all. We really need to do a functional assessment, a thorough assessment of problem behavior, skill deficits, and skill strengths to determine effective treatment for that individual. The sort of tips that I came up with to provide are things that I have just over and over again working with schools and residential and families. I feel like they're constant things that you bring up, and it's not just for individuals with challenges or with different abilities. It is for the typical developing sibling that's over there in the corner having a tantrum. I mean, we see these things, so I don't always want to focus on individuals with a diagnosis per se, or something.
It's behavioral strategies that are across the board.
Across the board. Again, yeah, sibling, use it on your spouse. I'm telling you, this stuff works. With that said, the first one I think is so important, and I work a lot with school districts on this, because it's that whole catch a kid being good, catch someone being good. How often are we bringing up and bringing to the attention of others or the individual what they've done right? Not as often as what they do wrong. And a great example of a little boy I worked with, a 4-year-old, and he got these sheets sent home from daycare, or his 4K in preschool. And every class period or time period, there was a sad face and a smiley face. And he or the teacher, whoever was circling them, circled it for each time period, if he had a good time period or a bad time period. And for the entire 30 days of the month that I reviewed, every happy face that was circled, meaning he did well, had no comments by it. Every sad face that was circled had about 2 to 3 sentences talking about what he did wrong. And so that was really powerful just visually to me. And the mom, in reading those sheets, would cry every time she got them. She was having a real emotional struggle with dealing with the issues her son was having. And the reality was, in observing him at school, he did a lot of super awesome stuff, and none of that was being communicated. So I really think that one thing we can do as caregivers and providers and spouses and supervisors and with the people, our colleagues that we work with, is say, draw attention to what's being done well, making sure we're going out of our way to say, hey, Timmy, I love how you raised your hand to ask a question. That was awesome. Or way to go, waiting your turn. That was really good. I love how you sat there patiently. Instead of just saying, stop talking, you're talking out of turn, sit down. There's a lot of times in classrooms, even fantastic teachers it's kind of like putting out fires, like reactive versus proactive. And we talk a lot about that with treatment, is what are we going to do proactively to prevent problem behavior? Because that's important. And then how do we respond reactively? Well, a lot of times treatment plans are more heavily emphasizing proactive versus reactive, which they should be. So I think just really making sure we are making sure good behavior gets good stuff. It's got to be, there's got to be payout for it, or we're not going to do it. And, we do what works for us.
And would that be something, because I know actually when my son was in elementary school, we did have that same chart.
Yeah, very popular chart. Yes.
All the different things, and then ADLs for the day, and, all of that. Would you say now, kind of looking at that, and as we teach more of this within the school setting, when parents are going in for that IEP, really making that a statement, like, I don't only want the behavioral chart within, my IEP written that we're going to do that every day, but we are going to try to acknowledge 4 successes per day, or find 5 great things per day, and make that in writing so the teachers it's a reminder to them, hey, let's remember to focus on some of the good too.
Absolutely. I think that's a great idea, Tammy. And that's coming from that's a mom's brain thinking, right? I love that. And because that IEP, if it's not in there, they don't have to do it, and they can mean to, and they can really intend to, but I think putting it in there something. And again, that's just shifting perspective. I really believe that a lot of behavior analysis is my passion. It's a science, it's evidence-based, it's beautiful, and it's powerful. We have to get it's part of it is getting a shift in perspective. How are we looking at things, right? Behavior isn't just bad. Behavior is good, bad, and neutral. Behavior is just what we do. It's the act of doing, right? So it's shifting this perspective to not just look at the bad, but look at the good. And even our most challenging kids, our most challenging individuals, they're doing something good every day. I have yet to meet one that doesn't. So even if it's just sitting quietly for 3 seconds on the couch, whatever, that might be the good for that little, for that young man or that individual. So it's about figuring out what we can give for good behavior. Is it just our attention? Is it, and I know a lot of it, there's a lot. We could talk forever on the idea of reinforcement, and which is reinforcement by definition is any consequence to a behavior that increases the likelihood of that behavior occurring in the future. It's not stickers or M&Ms necessarily. It's whatever that consequence is, whatever comes after that behavior, that is going to increase the likelihood of that behavior occurring. So that takes this very simple number one kind of strategy takeaway and complicates it even more, because what is reinforcement to you may not be reinforcement to me, may not be reinforcement to Johnny. So attention, a high five, a thumbs up, way to go, may mean nothing to somebody. But giving them a sticker or a pop tab or a token or whatever that tangible item is, or a get out of chore free card or a break card, whatever that thing that we're going to give them following good behavior is, that gets more complicated. And we could talk a lot about that.
That could be a whole other segment in itself.
That could be a whole other segment, yes. And I would love that. That's my favorite topic, because I really feel like it's so misunderstood. People assume reinforcement is tickles and M&Ms and high fives. Well, maybe not.
Right, because it really depends on the individual.
Yep, and it depends on what impact it has on the behavior. Does the behavior go up? Because by definition, reinforcement increases behavior. So if the behavior doesn't go up, it's not reinforcement. So
okay, we got to really dive in. I think that also goes for when we look at types of, I don't want to call them punishments, but things that we're going to do as what is your consequence going to be. For some people, they're like, oh, if I take away Johnny's, and I'm video game, or I take away this. But then sometimes you have, individual young adults or people who don't care.
They don't care, right? And it's not effective. It's not a punishment, right?
It's not a punishment.
Right? So reinforcement increases behavior. Punishment is a consequence that follows behavior that decreases the likelihood, right? So if what you're doing as quote punishment isn't successfully decreasing the problem behavior you want it to, it's not really punishment, right? So we use these terms and we're like, and research is very, very clear. Again, I'm going to go back to research a lot. ABA is data-based. We track these things. We measure these things. So we can see, is the behavior going up? Is it going down? We just don't arbitrarily say, oh, things are good. We say, no, there was 10 incidents of physical aggression for 3 consecutive days, and now it's at 0. Our intervention's been effective. So we really want to look at, is our consequence having an impact on behavior? And is it going the right way? Is it doing what we want it to do? And if not, we need to change it. And then we need to figure something else out. But a lot of times those punishments are not actually punishments. And I actually have a funny story. A little boy I worked with probably 15 years ago he would come to the clinic. I used to work in a clinic in Indiana. And he would come from his preschool or his early 3K or 4K program and come to the clinic. And he was a little boy with Downs and autism, which is a really, if anybody's ever known an individual, it can be pretty complex. I mean, they can have some pretty significant behaviors. And he would come in and the mom would say, yeah, he was in timeout 32 times today at his 3-hour half-day preschool. And we're like, something's not working, right? Well, it turns out we did a functional assessment of his problem behavior. It was escape maintain. So this little boy was acting up in group time so he could go to timeout. The function of his behavior was escape. So their punishment was actually reinforcement. So we had to work with them to kind of see that it's not, and again, that template approach. Oh, he's throwing his shoes, send him to timeout. Throwing his shoes, send him to timeout. Well, nobody did a functional assessment to say, no, that's where he wants to go. So.
Oh my gosh. Okay. We need to do a whole segment on that because I so relate with that. All right. We're going to move on to number 2.
Okay. Number 2, sterilize the environment during behavior escalation. So when we look at problem behaviors occurring, we can't make a lot of people do anything. I mean, you can't make a kid stop tantruming, right? I mean, you can't physically make them stop, or you can't physically make them. What we need to focus on, what can we do, right? We're the environment. We somehow contribute to this behavior. When in doubt, the best thing to do is just sterilize the environment. Make sure that during a behavior escalation or problem behavior, they can't have access to their favorite cookies, or their TV is on, or they can go and get in the hot tub and relax, things that they like. Sterilize the environment. Because again, the big thing is we need to make sure good behavior gets good stuff. Good behavior gets you a lot of good payout. Right. It has to be worth it, right, to be good. What we could do with bad behavior, so the behavior that we don't want to see, is just make sure it doesn't get access to good stuff. It can't, because then it'll just strengthen that behavior. If I know, it's kind of, I use the example, it's silly, but if I would come home from work and I would just cuss my husband out up and down and be super crabby with him, and then he came up to me and gave me a deep tissue back rub, well, I'd be likely to come home and cuss him out every day and yell at him and be mean, because I love massages, right? So if we let bad behavior get good stuff, it's just going to get stronger. It's going to be reinforced. So the best thing to do without doing again, I recommend functional assessment. I really recommend ongoing treatment and supervision of programs by a behavior analyst. This isn't like a catch-all. Right. But if you have a typical 6-year-old little girl tantruming, which I have a daughter who does sometimes, all I know is that during that time, she's not going to be watching her favorite show. TV goes off, toys go away, environment is sterile, and I'm not going to talk to her. And then when she stops, we can resume. So you're just teaching them that there needs to be a contrast. Good behavior, good stuff, good stuff, good stuff, good stuff. Bad behavior, nothing. Does that make sense? Yes. So that's just like one thing that I work with parents a lot on when we first start treatment, is not having an assessment done and a treatment plan developed, is for now, just make sure they don't get any good stuff. Just remove it. And that good stuff could be you. That good stuff could be you telling Timmy, don't do that. Knock it off. Quit it. You shouldn't do that. Because then they have your one-on-one attention. So if there's an attention component there at all, just that reprimand could be reinforcing the behavior. So we just say, when in doubt, just sterilize.
Right. That's it. That is good. 'Cause sometimes I know that happens because I think that sometimes kids even, or I mean, obviously adults do it too, but
Yeah.
like you instigate to want to hear more, but then
Yeah.
you're engaging the behavior to continue. So if you just cut it, silent.
It's again, this is all easier said than done. I mean, this is hard because again, as parents and caregivers, we have our patterns of behavior responding to,
Right.
and getting parents, when they're, and adults, children too. I mean, when your kiddo is saying something to you, they know those buttons. Kids know our buttons and they will push them so many times and so hard. And there are certain families that I work with where there are certain words that my client has learned to use that are bad words, very, very derogatory words, because they get such a reaction. And the caregivers it's like they can't physically not respond to it at times.
Right.
They know that.
Right.
Yeah.
So that could, I feel like each one of these could be a whole hour in itself.
We're
gonna have to revisit. All right, number 3.
Yes, follow through with demands,
or
don't
follow through.
Follow through. We've heard this, right? And the thing is, it's easier said than done. I am a parent. I get it. The thing is, again, a lot of what I work with families on is proactively thinking about things. So once we say something, once we say clean up your toys, they better be cleaning up their toys, right? Because otherwise we're just teaching them they don't really have to listen to us.
Right.
If we know that the individual, and I use kids as this, again, this doesn't only apply to kids, but let's say, your kid's tired, they're hungry, it's late at night, they got toys all over the place. One, if you think they're going to have a fallout freak out, it's almost bedtime, you got to make dinner, and you can't follow through with that demand, just don't give it. It's better to not give a demand than to give a demand and not follow through. Because what we're teaching then is that problem behavior will get them out of doing something they don't want to do. So you either don't give the demand, or if you're going to give the demand, it's okay to give a modified version of the demand. So say, pick up 3 toys and I'll pick up the rest. Again, then you got to make sure they pick up 3 toys. But I think parents sometimes get caught up in they should pick up their toys. That's what they should do. It's their responsibility. Yeah, I get it. But the truth is, what's probably going to happen is you're going to say, pick up your toys. They're going to have a tantrum. You're going to run out of time and you're going to pick them up anyway. So just pick them up. Skip all that. Just pick them up. And then we do, I'll work with families to do some compliance training and things, like if there is a lot of escape maintain behavior. So there are kids that are just highly non-compliant. I mean, you say the sky's blue and they say it's black. I mean, there are kids that are they're not going to do what you tell them to do. So we have.
And I think that some of that probably wavers on to where their intellectual, developmental ability is too. So sometimes, when you're trying to describe something, this is what needs to be done, they may not even understand what the demand clearly is, or you're giving them too many step directives.
Yep.
At one time, and they can only handle the one, and then you're giving them 2 or 3, and that's overwhelming.
Absolutely. Great point. Absolutely. Yeah, absolutely. And a lot of times too, it's just overwhelming. I mean, I've worked with siblings of clients that have struggles with this, and absolutely, no differing abilities, absolutely typical neurotypical developing child will be overwhelmed. If you say go clean your room, they just oh my gosh. First of all, that means I can't be around attention for forever because I have so much to clean up in my room, and it's just overwhelming, right? So a lot of times we have to look at I would rather see a kiddo pick up, or an adult put away 1 piece of clothing 5 separate times than tell them to put it all away at once and then evoke problem behavior. So you just have to look at how you're presenting demands, but then making sure whatever demands you present, you follow through with. Because what you don't want to happen, again, good behavior, good stuff, bad behavior, nothing. What we don't want is for problem behavior, and when I say problem behavior, it can be tantrum, it can be talking back, it can be cussing, it can be hitting, it could be self-injury, whatever. We don't want problem behavior to result in any improvement in their environment, because all that teaches them is that if you act this way, things get better. So to present a demand like go clean your room, child has tantrum, and now the demand changes to, okay, don't clean your room, just pick up your stuffed animals. I get why we do that, but you can also see how sometimes that could snowball into problem behavior increasing because it resulted in an improvement in the demand.
Right. And this is something that, though, as parents, a lot of times we will do it repetitively. So it's not just like the one time, like, oh, that one time last summer in 19, whatever it was, I said to my kid to do. This is something that could be an everyday occurrence, every couple day occurrence. One strategy I know from, one of my son's therapists that we do sometimes now is I will not give the demand that evening because I know it's like already in breakdown mode, is I will say to him in going to bed in the morning, this is the list, and this is the first things you're doing when you get out of bed.
Yes.
You know what I'm saying? Which then you're laying the demand down, but at least I don't have to reverse back on it because you're right. If they're going to lose it, half the time you end up picking all the stuff up or doing whatever task it was that they needed to do.
And we repeat it. You're exactly right. We repeat it as parents because it's reinforcing to us. Because what does it do? It stops the tantrum. So that's negative reinforcement. So by us modifying the demand, it's not only reinforcing to them because their life just got easier, but it's reinforcing to us because we got the tantrum to stop. So you see all these principles are applied across in all sorts of situations. It's not just that the child or the individual we're talking about.
So don't demand something you can't follow through on.
That's right.
All right. Number 4.
Avoid saying no, then changing to yes. Okay. After problem behavior, it's better to just say yes. So a lot of times what we'll see is parents, that they have, again, it's about proactively thinking about it. Can I stick with no? When I say no, is it going to be something I can follow through with? Or are all these other things going on and I'm going to end up giving in anyway? Just give in right away. So that third cookie, right? Let's say there's this the kid wants a third cookie and you said no more cookies. You gave them the second cookie, no more cookies. Well, then they freak out and fall out, or no more phone, whatever it is that could evoke strong problem behavior. And then it turns into, okay, you can have it for 5 more minutes. What do we just do, right? And we just taught them it's no until you get really mad. Then when you get really mad, it turns into yes. Instead, just don't say no. Again, it goes back to don't give the demand. If you can't follow through with it, it's okay to not give it. It is okay. I think as parents are saying no, it's okay to give a third cookie. It's okay. Like, is it ideal? Maybe not, but it's better to just say, you're going to end up saying yes anyway. Just say yes from the beginning and don't go no to yes, because then we're just teaching them to use their problem behavior to change their environment to be better.
Oh my goodness. I'm going to be thinking about this all day today now. And every answer I give. This is so good stuff. All right. Number 5.
Okay. Provide non-negotiable demands as statements rather than questions. This is the number one thing I see in classrooms. And it's funny because it doesn't take long to change it. You point it out and people start recognizing it like, oh, shoot, I just asked. And the kids I work with will tell you no. So if you say, can you push in your chair? No. Well, you asked him. You asked him and he said no. He has a right to that. If we ask them, and you should ask, you should give choices and give options and say, do all of that. But there are some things in life, and we know as adults, that are non-negotiable, right? There are things that we have to do. So if there are non-negotiables, present them as statements, not questions. Because if you ask them as a question, they have a right to answer. So if they don't get an answer, they don't get the right to answer, right? It is time to put your boots on and go home. Don't ask them to do it. Because then when they say no, what are you going to do? And I've had teachers look at me like, now what? And I kind of look at them and say, you're bad. Like, I don't know what to tell you. You asked them, right? So we have ways to work around that. But once you point it out, then you'll start seeing it's so fun. It's fun to watch because then you point it out and they'll catch themselves and be like, oh, wait, no, I mean, put your boots on, and they'll start correcting themselves. And as parents, we do it too. I do it with my daughter. And she will answer me in a way that I don't want her to answer me, which will correct my behavior. And I'll say, you know what? Mommy made a mistake. That wasn't supposed to be a question. So now you need to do.
So that's your way you can go backwards.
Exactly. And I advocate a lot for accepting responsibility and saying when you screw up. So you know what? I messed up. I shouldn't have done that, but this is what you need to do.
That is, that's a good tip because a lot of times we do that. We pose things as questions versus being the non-negotiable.
Exactly. Exactly. And they don't have a say over everything. It's okay. They're not supposed to. Sometimes we all have to do things. Yeah.
All right. And are we on number 6?
Yes.
Number 5. Oh, we're on number 6. Okay.
Yes. Yay. Okay. And this is more, this is just a little floofy, but I wanted to throw it in there just because I feel like it's a struggle for a lot. I mean, and it's hard to avoid personalizing problem behavior. It's not even those really bad days, those really bad behaviors, those really bad words, those really bad things that are said. It's not personal. It's not about, oftentimes it's really just about the cookie. It's not because he's mad at you or doesn't love you or hates you as a mom. It's really just about the cookie. So like individuals, I have a client that I work with that has really vulgar language that she uses to get a rise out of people. It's very attention motivated. And it's hard not to personalize it because she uses it in a way that feels very personal, but it's really not at all about the other people she's talking to. It's very much that she's deprived of attention and she needs attention from her environment, and it's the only way she knows how to get attention. I should say it's the only way she knows how to get attention. It's the most effective and quick way to get attention when she needs attention. So it's not personal. Mom, she doesn't really think her mom is the things that she calls her. It's just she's trying to get mom to react and interact with her. So I think working with families to get them to see, kind of become a little bit desensitized to some of that stuff, that this is not personal. And that's where we come up with treatment plans and write out specific protocols of responding. So we can eliminate the emotionality part and say, right, you're going to do A, B, C, and D. No matter how you feel, you're going to do A, B, C, and D. And then we're going to see if we can change the behavior. Because if we rely on our emotions to respond, we all know what that can do. It's not good. So
right.
So really try to and and I don't want to make it sound like that's easy. It's very difficult to do. It's very difficult. But once we can get to that point, and there are parents that do and can, it makes everything kind of a lot easier, I think.
Right. And, I think some of that, especially when we talk about more extreme behaviors or violent behaviors,
yes,
that you're trying to manage, having that assessment that you're talking about and somebody working with you on an individual basis, okay, and identifying, as you were speaking of, this is why they're getting the reaction. This is why this is happening. Let's do X, Y, and Z. So you have something to template to follow, because these are very general. And like you said in the very beginning, may work for, some they're good strategies. They could be used in your work environment. They could be used with your kids. They could be used with your spouse in any way that way. Now, when you're talking about having that behavior analysis, is that a whole team that does that? Or if we're just talking about the behavioral end of it, would that be just like a person like yourself? One person can do that?
One person can do that. So I'm a board certified behavior analyst, which is a national certification. And there are BCBAs. Wisconsin has a licensed behavior analyst. So there are several states. And again, like I said, it's growing and it's expanding, but there are several states that actually license their behavior analysts. Not all states have that, but the BCBA, there's board certified behavior analysts, our master's level. BCBAD are doctorate level board certified behavior analysts, and then there's BCABAs, which are board certified assistant, I think they're called now. They used to be associate, or maybe now they're associate behavior analysts. So they're like a tier, they're bachelor's level assistant behavior analysts. And they're the people that are typically responsible for doing assessment, writing programs, and implementing interventions. And there's a website, so the B as in boy, acb.com is the behavior analysis certification board website. And on there, if you're in a different state, you can go on and search for a certificate. So you can find BCBAs in your area. And they may work for an agency, they may work in private practice like myself, and you can reach out to them and just inquire about services. But that's typically who would be responsible.
Right.
These type of services.
Because I think that when we're talking about high behavioral levels, just thinking, okay, well, I'm going to go through these 6 things and that's going to work. Obviously, you need a map and you need a plan and you need it to be very individualized because you don't know exactly what that trigger is, what the response the kids are looking for, what they're really absorbing. Like you're talking about the one boy who wanted to go into timeout.
Yeah. And typically, and this is a very general, everybody, I'll just say from my perspective, from my practice, everybody's different. It's very individually based, but typically an assessment can run anywhere 6 to 10 hours, development of a treatment plan anywhere from 4 to 6 hours, and then you have training after that. So it's a very involved process. It's not a quick fix. We're not going to walk in and just give you that template recipe for fixing these, especially because there are significant behaviors that are very dangerous and risky, and it takes a lot of time to develop a good plan. And then we have data that we collect and track progress daily, at least weekly for sure, to make sure that our behaviors are going in the right direction. Then we make revisions as necessary to that.
And with kind of the lack of the amount of need and individuals that actually do this, would you say parents as young as possible, if they're starting to see these needs, if they're starting to engage with someone, to look up who's in their area and start to work right away? At least get your name on a list, because I'm assuming that you can't just call and get people to come to your house for 15 hours.
No, you can't. And, it depends. States are vary from state to state. There's a lot of insurance funding now. I know Medicaid covers ABA treatment. The funding has come leaps and bounds just over the past 10 years as far as availability of funding for behavior analysis, but absolutely don't wait. And even, I really encourage parents specifically where if you're not seeing progress, first of all, demand data. Okay, there's a lot of treatments out there that are just kind of, anecdotal data where it's just, oh, they did good today or they didn't do good today. We want data. We want to see, is this improving behavior? Because if not, we don't want to waste our kids' time, or adults' time for that matter. We don't want to waste time. We are obligated, and as behavior analysts, that's why I really advocate for BCBA, because we are obligated by our ethics to make sure we are tracking progress and making changes when they need to be made. I've worked with so many families that have spent years in a treatment with no evidence of efficacy, and now those years are gone. And then they get referred to a clinic or to a behavior analyst or to an evidence-based program, and it's a lot harder. And there are individuals that I get referrals for, and as sad as it is, ABA is effective and behavior analysis is effective, but it cannot be implemented in their current home environment because it's too dangerous. So at that point, even though from a science standpoint, we can develop a plan to make these things better and improve skill deficits, it's not safe to do at home. So then a recommendation at that point, it's like, it's not too late for treatment, it's not too late for progress, but it's too late for them to be at home. So that's where we want to get started early. I love that you brought that up. And even teachers, or it gets frustrating to get referrals where things have gotten so bad and so out of control. And we're talking about an adolescent that's been in the system for so many years. It's really hard. So parents need to be educated. They need to reach out. I'm happy, I have a website that parents can go to and contact me. I'd be happy to help with resources if I have them available, or at least point them in a direction to look. Because the whole wait and see approach, it's not good enough. It's not good enough for our individuals.
Right. And for, a lot of our either young adults or kiddos, we start them out sometimes when we do have behavioral issues with seeing a counselor. Sometimes that stems into seeing a psychiatrist. When do you feel like, as a behavioral analyst, that all of you guys kind of work together? Should those counselors, if they see that there's a need and they're not getting far enough within that weekly treatment, that they should be referring out to behavioral analysts? Or do you see that that doesn't happen often?
That's a great question, Tammy. And part of it is disseminating information, educating the community, which is what I know myself and a lot of colleagues and behavior analysts are really trying to do, because I think there's a lack of knowledge about that for other professionals. I think that professionals overall, in whatever field they're in, have, do no harm and do for the greater good of their client. They all want to do that. But if they don't know, they don't know. And I work really hard with my client, and I know other agencies I've worked with do too, to network with psychiatrists, with pediatricians, with counselors, with case managers, with, again, it's a very integrated approach across providers and support systems. I do have one psychiatrist that I work with that has probably sent me, I think, 10 to 12 referrals in 2 months, because I reached out to him for adolescent I'm working with. Nobody's reached out to him before, and she was on extensive medications. So I wanted to collaborate with him so I could provide data to him when he's doing medication management, so he would know, instead of just taking parent report, how things are going.
Right.
And he was so appreciative of it that he's just referring everybody to me, which is great, but I can't necessarily serve them all. They're very challenging. So I feel like that's made a difference. I think once people see what we do and understand it, it's not as scary. It's not as, first of all, they know about us, and it's not like we're trying to tell them to do their job. We really just want to collaborate and work together. So we're working towards that. I do think that there should be an element of responsibility to refer if
Right,
things
kind
aren't
of like
well.
those, those layers of, once you're going in, because I know that when we talk about the world of even, taking your child to a psychologist, psychiatrist, there's such a shortage there as well.
Yes.
I have been told, once you start to see someone, even if you need to transfer, don't get off the list. Don't get off the list, because you will not get the opportunity to get back in with someone for months sometimes. And for, some kids and families in crisis, that can be detrimental, if you need to talk to someone and there isn't that intervention.
Absolutely. And I think that, it's for every individual person. It depends on what their needs are and what sort of struggles they're having. If they're more clinical issues, depression, anxiety, things like that, and they have the ability to process or discuss and sort of take perspective and things. I think there are certain prerequisite skills necessary to benefit from more traditional counseling services and clinical services. But again, when we look at the problem behavior we're talking about, or that I deal with, sitting in a clinic setting wouldn't do much. I need to be there with the families. I need to be coaching the families. I need to be dealing with the same behavior that they deal with, so I know what's going on, so I can assess it. And I haven't, like I said, it all depends on what the need of the individual is, but typically those traditional counseling sessions, for the population I work with, they have not been very effective. And I believe there's some research on that as well. But, medication management is something we work with a lot, because I think I have had one client not medicated in the past, probably, if I guess, 5 years. I mean, they're all on some sort of medication. Right. So again, we want least restrictive interventions. We want the least amount necessary. We can't just keep adding medications to these kids. I have kids on 8, 9 medications. It's not okay. But again, the psychiatrists are doing the best they can with the information they have. So it's our job to give them objective, even as parents. This is something parents can do. You don't need a behavior analyst. If you're getting a medication prescribed for aggression, track aggression. Take that data to your psychiatrist every day. Put a tally mark every time they hit you, and take that data to your psychiatrist. And if that aggression is staying at high rates, one, maybe the medication isn't right? Maybe the medication is causing aggression. We don't know. But the psychiatrist can't, or doctors, they can only work with what they're given. So give them as much objective information as you can.
Right. And that is so important, because like you said, those doctors are only seeing a snapshot. And if you're already frazzled and you're going in and you're saying, it was like this or like this these days, and I think it was on Wednesday and Thursday he did this, what I'm saying? The data is up and down. And you're right.
Yeah.
Mm-hmm. And medication.
Exactly. And there's actually I can't remember the name of the study, but there was a research study done on reporting. So basically the report of the caregivers that go into the psychiatrist is very contingent on the kind of day that they have had. So whatever the day that not just the individual, but the caregiver. Mm-hmm. And so if the client had a bad day that day, the report is horrible. So they could have had 12 days of beautiful behavior. But if they had a bad day before going to the psychiatrist, the caregiver's report was reflective of that day only. So that's where it's really important to get that longitudinal data, get that objective measurement across time, even for parents to see, hey, today felt really bad. I love pulling up graphs and saying, I know today felt really bad, but look at his data since March. It's beautiful. He's making progress. It's going the right way. So I can't say enough, again, as a behavior analyst, we love data, and it is our meat and potatoes. That's what we do. So as much as we can get data used appropriately and effectively, it's just better.
And I say that across the board when we talk about advocating for your elderly loved ones, for your children, for yourself. Tracking is really the most important, because or else all of these doctors, psychologists, whatnot, you're looking at a snapshot. That's all you're seeing is this little snapshot, and whatever is in there is what they're going to go off of. And when we talk about people being put on medications, that's when it becomes, it's one thing if it's just in conversation, but we start getting meds for things, as we know over time, we start our kids on meds at the age of 5 or 6 or 7 or 8. It's a long lifetime, and we really need to be conscientious that we're making sure they are not on too many medications, that are they on the right medications for, their health and well-being overall, not just the behaviors, but the insides.
Yeah. Because it takes a toll on your body. Medications there's no free lunch, and if you need them, you need them. But it's figuring out, do we need them? How do we determine that, right? And just because we need them now, does that mean we need them in 10 years, right? Where's and adolescence hits and puberty hits and hormonal changes and physiological changes can do it can have a huge impact on the medications that were effective, may not be. And it's a really tough part, I think, to navigate. And but we have to just, as parents and caregivers, stay on top of that
all the time. Well, Sarah, your information is so good. So good. I love it.
I love that I'm able to do this.
And looking forward to, I know we're going to try to elaborate on some, of these topics in the future, but you do have a website. So I'm going to drop that below all the commentary in here. So it will be there for you guys to go to. And you said that you're open if anyone has questions or they need help in any way, maybe getting referred over, to what your thoughts are on something, that they can send you a message of a contact page on your website?
Yes. Yep.
Okay, for doing that. And then we're also going to post the link for the licensure, right? What is that one?
The BACB.com, if people want to look for behavior analysts in their area. And then if you're in Wisconsin, Wisconsin has an association for behavior analysis. It's a state chapter, so there's an international chapter, and we're a state chapter. So that website too, I think I sent you.
So I'll get that one up as well. The national chapter, do you have that where you could just send that over to me so that I can get that posted as well?
The international one?
Yeah.
Is there? Yeah. Mm-hmm.
Okay. All right, perfect. Well, then we will drop all of that content below. Sarah, I thank you so much for taking this hour this morning with us and giving us some great strategies, navigational tools that we all can try through the holiday season, through the year, on a daily basis with not only our kiddos, but also, like you said, your spouse, your family, all the people coming over for the holiday. For all those things. So on that note, thank you so much for joining us this morning here on the On Air Advocate. If you'd like any more information about the On Air Advocate or any of our other resources or services that we offer, you can go to www.onairadvocate.com and you can find them all right there. Also, if you want to become part of our private Facebook community, you can head up to the top of this Facebook page, hit the blue button, and that will let you into our private community. So on that note, everyone have a fabulous Tuesday, and thank you so much again, Sarah.
Thank you. Thank you, everyone.
All right. Bye-bye, everybody.
Bye.